Now, before we dive into the signs and stages of labor in more detail, I want to give you a quick deep dive into your anatomy. So, I have my handy model here. And as Miss Frizzle would say, let's go inside. Now, this is a model of a pre-pregnant body. I want to point out a few things to you. This is the uterus, and it has three parts. The first part is the cervix, which is down here. Gets a lot of airtime. You probably heard about it. It dilates during labor and opens to about 10 centimeters. Right above that is the body, which is basically the main expanse of the uterus. And then over here at the top is the fundus. Now the fundus is interesting because it can be used to measure how far along you are in your pregnancy. Your care provider might use a tape measure right from the top of the fundus all the way down over your belly to your pubic bone to get an idea of how far along you are. Now, what I think is really important to notice here is how close your uterus is to all of these other organs and features in the pelvic region. Namely, the bladder, which is right here, which you might have felt some pitter-patters from little feet inside of your belly. And then right behind the uterus over here is the rectum. So peeing and pooping, which I'm sure you already know at this stage of your pregnancy, has highly been impacted by your baby. And that's because your uterus is overhanging your bladder and leaning back onto your rectum. So not really having a lot of space in your bladder has probably led to frequent urination and feeling a lot of rectal pressure when you're pooping, or even when you're not pooping, feeling on and off rectal pressure totally makes sense. So hopefully that kind of demystifies some of what you've been feeling in this area, knowing how close everything lives together. The last thing I want to point out to you is the actual canal of the vagina here. And then a little bit above that is the urethra, which is how urine exits your bladder. And again, keeping in mind that close relationship. So getting a better understanding of how all of these organs and features are interacting can really help you understand why you're feeling a lot of the sensations that you're feeling in your body throughout your pregnancy, and especially through the different stages of labor. And now that you have some anatomy geography, let's dive into the signs of labor. There are three categories of signs, but it's important to note that these signs don't happen sequentially or one after another. They happen more cyclically. Think of it kind of like a weather pattern. You might have some, but you might not have others. So the first category of signs are subtle signs. These can happen around 35 weeks. Lightning is one of the subtle signs of labor. And to share more about it, I have to grab my handy pelvis. Here. So, lightning happens when your baby's head, which will not be disembodied, starts to drop inside of your uterus and further down into your pelvis. So, somewhere around 35 to 36 weeks, that process will happen. And what happens when your baby's head drops further into the pelvis, the head of your baby becomes engaged, puts pressure on the cervix, which is really important for effective contractions, and also, most important, even before labor begins, to help the cervix to soften and to thin. The next subtle sign is restless backache. And that comes from the fact that your pelvis is taking quite a lot of strain as your uterus expands and your baby grows. And that strain really happens in this sacral region. This is your sacrum of your pelvis. Now, the restless backache, if I face the pelvis back towards you, is because as your uterus expands and your baby grows, your pelvis starts to tip more and more forward, pulling on your sacrum and pulling on all of these sacral ligaments that insert into your sacrum. So that pulling forward creates a lot of tension and can create a lot of discomfort. And so that's why this feeling of kind of teetering, feeling a little restless in that back area and feeling a lot of potentially pain, even sciatica, those things all happen as a result of the growth of the baby and the expansion of your uterus. So restless backache can start to come up even more towards the end of your pregnancy. Soft bowel movements are another subtle sign, which some of you might be really happy about because pregnancy typically means you've been constipated for many months. So, towards the end of your pregnancy, you might get a little bit of relief. And that relief comes from a hormone called prostaglandins, which is a really important hormone for labor. It helps soften and ripen the cervix. It also increases the contractility, which is the tensing and releasing of a muscle, and the motility, the movement of certain blood vessels in the abdominal region, which is why you have what I call a pick up and poops towards the end of your pregnancy. Now, remember, going back to our anatomy geography, how close your rectum and your stomach are to your uterus. So it really makes sense that this hormone prostaglandins that's helping your cervix, which is the entryway to your uterus, soften and open, is going to also impact your stomach and your rectum, which are right alongside. So that can definitely be a sign that you want to share with your care provider or your support team if you're working with a doula, because that let me know that my client's body was really starting to tune up for labor. The last two subtle signs of labor are more about your energy and state of mind. You might find around 36 weeks that you have this deep desire to nest. And really, the way I think that nesting looks is a lot of energy, a big burst of it, followed by a lot of exhaustion. So it's really that toggle is how I see nesting showing up. So, for example, you might say, oh, I need to get all these things for the baby. And you just spend a whole weekend shopping, organizing, putting all of that together with this kind of rapid, intense energy. And then you're like, I can't do anything else for like 3 or 4 days. That is the type of vacillating between lots of activity that's hyper focused on the baby and then not wanting to do any activities at all. It's a pretty good way of identifying nesting behavior. The last subtle sign of labor has to do with how you are feeling. You might find yourself switching between hyperarousal and hypoarousal. And what that means is you might find yourself very excited, a lot of energy, feeling like you can do a whole bunch of things, or really anxious, overwhelmed. Those are hyper states. Or you might find yourself in a state of hypoarousal, feeling depressed, really sad, sluggish, resigned. And so floating between those two zones of feeling really aroused or under aroused is a really normal feature of the end of your pregnancy. And a lot of it has to do with the fact that you're going through a lot of hormonal shifts in your body chemistry, which are sending you up and down that ladder. So if you find yourself quick to anger, or finding yourself wanting to sleep a lot, or finding yourself a little lost in space or dissociative, that makes perfect sense. But if it feels like it's out of control, you always want to talk to somebody about it, whether that's your partner if you have one, or your support team, or your care provider. Now, last thing to keep in mind when it comes to subtle signs is that subtle signs, when they happen, doesn't mean that your baby is coming in the next week or even in the next 3 weeks. Remember, this is a pattern of signs that are creating this picture to give us an indication of when labor could begin. Moderate signs can take place from about 36 to 38 weeks. One of the first moderate signs is Braxton Hicks or false contractions. Braxton Hicks or false contractions are very different to a real contraction. And what makes them different is, firstly, they don't last for a full minute. They're usually very quick, or they last for longer than a minute, maybe up to 90 seconds or so. Secondly, with a Braxton Hicks contraction, if you get up, start to move, usually that stops the contraction in its tracks or really makes it feel like it's on its way out. Real contractions have a clear pattern, and they get stronger and stronger over time. And when you get up and move or use any comfort or soothing tools, it helps the contraction feel better, but it doesn't take it away or make it feel like it's on the way out. So that's a really easy way to create a distinction between a Braxton Hicks contraction and a real contraction. Now, the other moderate sign is your waters breaking. Now, I want to pause here for a moment and really lean into this moderate sign because it's one of those moderate signs that you've probably seen on TV and in movies most of your life. You see a woman, she's in the grocery store, making her way down the produce aisle, and then all of a sudden her water breaks and it's like clean up on aisle 5. That more than likely is not going to happen to you because the bag of water's breaking typically only happens for about 7 to 10% of women. The way you actually know that your labor is beginning is through progressive contractions, which we'll come to in a moment. But the reason why your bag of waters is a moderate sign, meaning that labor is en route, but you're not actually in labor, is because just your bag of waters breaking without progressive contractions means that labor hasn't actually started yet. So let's talk about what you need to keep in mind if your bag of waters does break. So if your bag of water breaks, you want to think about the word taco. You can even think about eating a taco. And taco stands for time, amount, color, and odor. You want to note the time when your bag of water breaks. And the reason for that is because your care provider, whether that's an OBGYN or your midwife, are going to want to note how long your bag of waters has been broken, or you might hear the word has been ruptured. And the reason for that is because when the bag of waters is broken or ruptured, your baby starts to become somewhat vulnerable to infection that could come from outside of the uterus. And not just in the outside world, but actually the outside world of your vagina. Because there's bacteria that's there that could potentially create some issues with the actual laboring process for the baby and for you. Now, each care provider is going to have their own approach to how they want to navigate your bag of waters breaking. Some providers feel comfortable giving you quite a bit of room and time to see what happens after the bag of waters breaks. Other providers might want to stay more on top of it and suggest that you come into the hospital or have them come to you when your bag of waters breaks. But the idea is typically when your bag of waters has broken, usually within 24, probably at the most 72 hours, the hope would be that your baby is delivered in order to prevent infection. A stands for amount. You really want to notice how much fluid was released when your bag of waters broke. Was it a trickle of fluid or was it a gush? Now, depending on what it is, it can be really important for you actually, if it was a gush, to keep the clothing where the bag of water's fluid landed so that your provider could take a look at it, potentially run a test on it to be able to see whether or not your bag of waters actually broke. Now, you might be asking yourself, how do I even know if it's my bag of waters breaking, or maybe it could just be pee? Great question. The way to tell the difference between your bag of waters breaking and whether or not you might just be peeing or there might just be an increase in discharge, which can typically happen towards the end of your pregnancy, is to get as flat as you can. If you're at home, you can get back into bed and lie down. If you're out somewhere and you feel comfortable getting on the floor there, you can do that. Or you could be in your car, recline your car seat back as far as you feel comfortable, and just rest for a few minutes, maybe 5, and then get up and notice if you feel more of that fluid or water releasing from your vagina. If you do that a few times and each time you get up you feel more fluid moving, that's probably a pretty good sign that your bag of waters is broken. Now, if you don't notice that there's more fluid leaving your vagina every time you're getting up after that rest period, then maybe your bag of waters hasn't broken. But it's still worth getting in touch with your care provider to find out what to do or to get some helpful next steps. Color is another thing to look for if your bag of waters breaks. The color that we're looking for with your fluid should be clear. Maybe there might be a little bit of blood in it, which is totally normal because the cervix is vascular, and anytime there's some cervical change, which would have to happen in order for your bag of waters to break, which we'll talk about in more detail in a little bit. But when there's cervical change, the cervix tends to bleed a little bit. So if your bag of waters breaks, seeing some streaks of blood in it isn't anything to worry about. But what we would be worried about is if the fluid is green, yellow, black, or if there is a lot of blood, hot, red, piping blood specifically. Now, if the color is anything but clear, this could be a sign that your baby has passed their first poop while still in your belly. And that poop is called meconium, and it could be a sign of fetal distress. So if you notice there is anything but that clear color, you want to call your care provider immediately to find out what to do next. And more than likely, the recommendation would be for you to go to the hospital if you're birthing at a hospital or birthing center, or your midwife would come to you, assess you, and figure out what next to do. Now, when it comes to the bleeding, as I mentioned, that's an immediate reason to go to the hospital. You definitely don't want to wait and see or call your care provider for next steps if you notice that there's a lot of blood. And the last thing is odor. The smell of your fluid shouldn't be too odorous. It should smell kind of how you know your vagina and that area tends to smell. If it's anything super fishy or kind of foul smelling, that also could be a sign of infection. And you definitely want to let your care provider know that. And again, the next best thing to do might be to go to the hospital. So let's circle up about taco specifically. If your bag of water breaks, you want to think about the time, the amount, the color, and the odor. And if there is any irregular bleeding, you want to skip all of that and immediately go to the hospital. There are two key signs that make up the positive signs of labor. The first is progressive contractions. That means contractions that are getting longer and stronger and closer together over time, unlike the Braxton Hicks or false contractions that I mentioned that are related to moderate signs. So, what does a progressive or a true contraction look like? Well, a true contraction is going to last for at least 60 seconds. It's also going to have a frequency or a pattern of occurring every 5 minutes. And then the duration of this pattern will be somewhere between 1 to 2 hours. So, a way to remember this is to think about area codes. You have 511, which means that you're having contractions that are happening every 5 minutes, lasting for at least 1 minute for a duration of 1 hour. Or, different area code, 512, you're having contractions every 5 minutes. They're lasting for at least 1 minute for a duration of at least 2 hours. 512, 511. Now, beyond this progressive contraction experience, the other sign that's related to positive signs is something called the bloody show. And for that, I'm going to need my handy biocervix model, which is here. Now, earlier on in this module, I gave you some anatomy geography. So this is a biomodel of a cervix. This cervix is closed, long and thick, so no dilation happening here. And we're going to talk more about dilation in a little bit. But really what I wanted to explain here is that the cervix is vascular. It's filled with a lot of blood vessels. Another part of your body that you have more of a familiar relationship with that feels a little bit like the cervix and has the same type of vascularity is the inside of your cheek. And so anytime you've cut your cheek, I'm sure you've noticed, or bitten your cheek, I'm sure you've noticed that it bleeds quite a lot, or even your lips are another example. So as the cervix changes, which means as it opens or as it shortens, it can bleed a little bit because of how many blood vessels are here. So as you're having these progressive contractions that might be in that 511 area code or that 512 area code, your cervix is going to change because contractions create change in the cervix. And as it changes, there might be a little bit of bleeding. Now that bleeding is going to be very different to the bleeding I described when I talked about your bag of waters breaking. The bleeding that comes with cervical change is called the bloody show. And it's more of a stagnant release of blood over time. And typically that release of blood over time is mixed with mucus and discharge. So it's not going to be a fast rate of blood leaving the body, unlike if there was an emergency or something wrong happening. Typically, when the bleeding would be happening, there would be a pace of blood or a rate of blood leaving the body. Bloody show is just going to be something that you'll notice, say, when you're peeing. You might notice that there's a little bit of blood in the toilet bowl, or when you pull down your underwear, you might notice that there's a little bit of blood on your underwear or your pad. And I actually would recommend towards the end of your pregnancy, pretty close to labor, starting to wear a pad. A pad can be a helpful way to track what types of fluids are leaving the body and give you a better baseline for yourself. Now, your mucus plug is a small plug of mucus, probably around the size of a pea, that is created inside of the opening or the os of the cervix to protect the baby from infection and to close up the uterus. Now, before I dive into the stages of labor, it's time for another anatomy geography moment. This, like I showed you earlier, is a cervix. The cervix is closed, it's long, and it's thick. Now, two things are going to be happening to the cervix during labor. The first is effacement. And effacement is the shortening and the thinning of the cervix. So this area, which is the cervix, will actually become shorter and thinner. Let me show you what I mean. This is a cervix that has effaced pretty considerably. It's actually shorter, and it's also started to open a little bit, which is the second thing that happens to the cervix during labor. It dilates, which means that it starts to open. Now, the combination of effacement, that shortening and that thinning, and dilation, which is that opening, brings us to this version of your cervix, which is a cervix that is open all the way to 10 centimeters. Dilation during labor is on a scale from 0 to 10 centimeters. Effacement is measured at a percentile from 0 to 100%. So you start off at 0% effaced and eventually become 100% effaced. And you start off at 0 centimeters of dilation and then eventually get to 10 centimeters of dilation. And your doctor or your midwife might describe you as complete when you reach full effacement and full dilation. Now, there are 3 stages of labor. There's early labor, active labor, and pushing and the delivery of the placenta. In early labor, your body is going to experience a couple of different things. I like to say that early labor is all about keeping yourself distracted. The thing about early labor that's important to keep in mind is it sometimes can be pretty long and kind of uneventful. Your contraction patterns won't be in the area code format that I shared earlier, so no 511, no 512. You might have contractions on and off for a couple of days, and you might start to notice a lot of low back pain that feels kind of like period cramps or period contractions, actually, because that's what your uterus is doing when you're having your period. It's contracting. You might experience that type of sensation for a number of hours or for a number of days. What's happening in early labor is that your cervix is starting to change. And typically during early labor, your cervix is going from about 0 centimeters to probably around 3 to 4 centimeters and effacing probably around 10 to 20 to 30%. So it's a pretty important but minimal amount of change. And in terms of the contractions and what you'll be experiencing in your body, I also describe early labor as being a stage to just distract yourself. And there's a number of ways that you can do that. You could run through a few different sensory meals. As I talked about in the sensory integration and pregnancy module, there are a lot of different tools, whether they're proprioceptive or vestibular or tactile or heavy work, for example, that you could do to distract yourself. So that could look like doing laundry, that could look like vacuuming, that could look like knitting, that could look like rolling around on your ball. There's a lot of different tools that you can do in that period of time of early labor to keep yourself distracted. The contractions will come and go, but you're still a pretty long time away from meeting your baby. So doing things to pass the time is key. So make that list of 10 things that you can do to distract yourself. The next stage is active labor. And that's when you start to have progressive contractions and those area codes come right on in. 511, 512, which for a refresher means that you're having a contraction every 5 minutes, lasting for at least 1 minute for a duration of either 1 or 2 hours. Now, there could be a little bit of a deviation from those area codes into another area code called 211, where you might be having a contraction every 2 minutes, lasting for at least a minute for the duration of an hour. Now, some people's labors will kick off like that. It's not that typical, but it can happen. And if you're noticing that level of frequency in your contractions, you're definitely going to want to call your care provider and have them come to you if you're birthing at home, or collect yourself pretty quickly and head to the hospital. Because when we see a contraction pattern coming in that quickly, it could mean that your labor might not last very long. Now, going back to the cervix, during active labor, your cervix is going to go from 4 to 6 centimeters of dilation and probably land up being around 50 to 60 to maybe even 70% effaced. So you're really well on your way. Now, in terms of how contractions feel in active labor, they feel very different. In early labor, I described that contractions could feel kind of like period contractions, or period cramps might be the term that you're more familiar with. In active labor, contractions come out of that low back area, wrap around the front of your belly, and they feel tight. You can actually feel that tension showing up, and you might even be able to visibly see your stomach tightening and maybe lifting a little bit as you're having a contraction. Also, the contractions are much more intense. They probably are starting to feel very painful, and you're having to use all of your focus and attention to manage those contractions. Very different to an early labor contraction where you could distract yourself. It's going to be harder to distract yourself when you're having an active labor contraction. And to manage your active labor contractions, you're going to want to use probably all the tools that I talk about in the unmedicated birth module of this class. So if you are in that 211 pattern, you definitely want to call your midwife and have her or them come to your home or head to the hospital to your OBGYN, because you might be going into precipitous labor, which means your labor is going to move really fast and you're going to need help sooner rather than later. The second part of active labor is transition and pushing. It's also the most intense, but the shortest portion of labor. What's happening during that time is your cervix is expanding and fully dilating to 10 centimeters and fully effacing to 100%. And in order for that to happen, your contractions pick up in frequency and in intensity. So you'll start having contractions probably every minute for about an hour. It's a really intense portion of labor, and you're definitely going to need your comfort tools to manage this particular portion. Whether that means you're having a medicated birth, having your epidural by transition would be ideal, or if you're having an unmedicated birth, you'll really want a lot of support, probably from your doula or your partner or whoever you've chosen to be there to support you during that time. Now, after transition and after you've fully dilated, your baby is actually going to descend a little lower in your pelvis. And when your baby gets to a particular area of your pelvis, what will happen is this reflex that will cause you to start pushing. And that process is called your baby laboring down. And that laboring down process allows your baby to stretch out your vagina, also known as the birth canal, to slowly make its way into the world. Now, pushing for a lot of women is the best part of labor, because after hours and hours and hours of contractions that you've been responding to with whatever comfort tools have made the most sense, when you start to push, you get to react to the contractions as they're happening. So when you start pushing, the contractions are about 90 seconds long, and they happen every 5 to 7, sometimes every 10 minutes. And the reason for that is your body is really intuitive and it knows that your uterus, which is this smooth muscle, is going to need a break in between squeezing your baby down out of your body. Now, what you also want to keep in mind with pushing is that when you have a contraction, that's when you push. So when you're pushing, you turbocharge the contraction that's happening already in your body. You use your force and your weight on top of that uterine contraction to help push your baby into the world. So it can be a really rewarding and engaged portion of labor because you get the chance to really work with what your body is already naturally doing. The pushing stage of labor, typically in a hospital setting, won't be more than 4 hours. Most providers don't really like to have you push much longer than that for a number of different reasons, primarily exhaustion and also stress on the baby. Keep in mind, especially for your first pregnancy, pushing is not easy. It's a little bit of a learning curve. So it's going to take you a little bit of time, but once you do, it really moves along. The final stage of labor brings together pushing and the delivery of the placenta. Let's dive into those final moments of pushing before your baby comes into the world. So you've been pushing your baby, whether it's for a few minutes or a few hours, and right on the cusp of your baby making their big entrance into the world, you go through the final stage of pushing, which is crowning. And that's when your baby is right at the entrance of your vagina and their head creates this pressure stretching your vagina open to make space for their head. And then their head is released. At this point, your baby is probably in your arms. You're overjoyed, overwhelmed with emotions. You've both done an incredible amount of work. But I want to quickly circle back to what might be happening in your vagina after pushing. After pushing, there can be some tearing. And ideally, we would want to let your body tear on its own as opposed to performing an episiotomy, which is actually cutting into the labia to make room for your baby. Episiotomies are no longer a standard procedure. There needs to be an emergent issue happening with your baby, something like shoulder dystocia, which is when the baby's shoulder gets stuck coming out of the birth canal, to require an episiotomy. What I would encourage for you to discuss with your care provider, especially when putting together your birth preferences, is to allow you to tear naturally as opposed to having an episiotomy. Here's what I want you to keep in mind when it comes to tearing. Tearing after labor or tearing as a result of labor typically takes place inside of the lateral walls, so the walls on the side of the vagina, not really on the outside. Outside tears that might happen on the major or minor labia are considered second or third degree tears. Most women typically experience first degree tears during their labor. This is probably a good time for another anatomy geography moment. This area on the outside is your vulva. The actual canal and orifice and opening is your vagina. Here's what I want you to keep in mind when it comes to tearing. Most tearing happens inside of the vagina or extending down slightly into the skin of the perineum. Tears more severe than that can extend down into the rectum and into the anus. But like I said, most women experience first degree and more simple tears that happen further up. And it's important to keep in mind when it comes to the healing of these tears, that these tears are going to heal in a moist environment. The inside of your vagina is moist, and so is the vulva, which is the surrounding structures, which are your labia, your vestibular bulbs, and your mons pubis. When you're wearing underwear, there's a lot of moisture there, and so the healing is actually going to be more rapid. It's not going to heal in the same way that a cut would heal on your arm or your leg with so much access to dry air, creating crusting or a terrible scar. The moisture of this environment helps to promote rapid healing. About 20 to 30 minutes after the birth of your baby, your placenta This nutrient-rich temporary organ that helps support your baby throughout your pregnancy will be released. You typically don't have to do any extra work to release your placenta, but your doctor or your midwife might massage your belly. And I call it massage in quotes because if you're unmedicated, it can feel pretty painful. But if you have an epidural, you won't really feel much at all, maybe some light pressure. But the idea with that massage is to really encourage every single part of the placenta to come out, because if any part of the placenta is retained, it can create sepsis in the body, and it can delay your milk volume from increasing, which we explore in more detail in the Feeding Basics module of the postpartum class. The final thing I want to talk about is how progress is assessed in labor. Your care provider is going to look at three things: how dilated your cervix is, how effaced your cervix is, and where your baby is in your pelvis. Now, you might be asking yourself, how do they do that? And the way they do that is through something called a cervical exam, which I'm going to walk you through right now. So you have your baby, and your baby is inside your uterus, placing pressure on your cervix. And then you have your vulva and your vagina. So your care provider, using a gloved hand, will probably put in 2 fingers, insert them into the vagina, feeling around your cervix to see how effaced it is, and to see how dilated you are, and to see how much of the baby's head they can feel in relationship to your cervix. That is how they'll be able to determine how far along you are in labor and be able to share with you your dilation and also your effacement. The final piece of how progress is assessed in labor has to do with pelvic station, which basically means, where is your baby in your pelvis? The further down your baby is in your pelvis, the further along your labor is. And it's the combination of your pelvic station, your cervical effacement, and your cervical dilation that will give your care provider and you a better idea of how your labor is going. Now, with those three components, what you want to keep in mind is that you need to get to almost 100% of effacement before you can dilate to 10 centimeters. So those two work hand in hand. Now, when it comes to pelvic station, what's important to keep in mind is that the lower your baby is in your pelvis, the more effective your contractions are going to be. When your baby is high up in the pelvis, it doesn't put pressure on the cervix and cause the cervix to change. So ideally, throughout labor, we want your baby to continue to keep descending into the pelvis, moving from a higher station to a lower station, eventually so low that you're able to push your baby out into the world.